Have you ever left a doctor's office with that nagging feeling that you weren't quite heard? You and I both know that what's left unsaid can be just as important as what's discussed. As a doctor, I've seen behind the curtain, and I can tell you that sometimes a simple question from your physician isn't so simple at all. There are 5 questions in particular that can be quiet red flags, signs that you need to pay closer attention. They can sound innocent, but they might be misleading or even manipulative. We'll walk through them all, but stick with me to the end, because the 5th one is disturbingly common, and it's the one that worries me the most. 1. Are you sure you want to know the results? When a doctor asks this, it may come off as gentle, even thoughtful, like they're protecting you from bad news. But let me be clear, this question is a red flag. Because why would a doctor ever hesitate to share the truth about your own body with you? I've seen this used in a subtle, almost manipulative way, especially with older women. It often shows up after a screening test, a blood result, or a scan. The doctor will pause, sigh, maybe even offer a sympathetic smile, and then say, "Are you sure you want to know the results?" Here's what's really happening. They're trying to emotionally manage you. And sometimes they're covering up their own discomfort, laziness, or lack of time. See, walking you through test results, especially complicated or potentially serious ones, takes time. It requires compassion, clear explanations, and a willingness to answer your questions. Not every doctor wants to do that. Some doctors use this question to subtly discourage you from asking too much, to downplay the importance of what they found. To gently push you into ignorance is bliss territory. But ignorance is not bliss when it comes to your health. Knowing the truth early is often the difference between catching something small or letting it grow into something deadly. I had a patient once, a 68-year-old woman named Janet. She came in with persistent fatigue. Her previous doctor had ordered blood work, but told her everything's probably fine. Do you even want to hear the full breakdown? Janet, trusting him, said no. 6 months later, after coming to me for a second opinion, we reviewed that same blood test. Her iron was dangerously low, and her platelets were dropping. It turned out to be an early warning sign of bone marrow issues that could have been addressed much sooner. So, listen to me carefully. If your doctor ever hesitates to share your results or acts like they're doing you a favor by withholding them, you have every right to be suspicious. A doctor's job is to inform you. Period. Not to protect you from the truth. 2. Do you really want to go through all that at your age? This one is insidious. It sounds like concern, like kindness, but under the surface, it's deeply condescending. Let's break it down. When a doctor asks this question, they're not asking about your capabilities, your preferences, or your goals. They're making a judgment based purely on your age. And it's one of the most common forms of medical ageism I've seen in my entire career. I once had a woman in her early 70s, sharp, vibrant, still walking daily, gardening, living a rich, full life. She had severe knee arthritis and had been to an orthopedic surgeon to discuss a joint replacement. But instead of going through the process, she came to me hesitating. I asked why she was reconsidering, and she said, "The doctor told me it might not be worth it. He asked if I really wanted to go through all that at my age." I was furious. This woman was a perfect candidate for the surgery. Her heart was strong. Her recovery potential was high, and her pain was affecting her quality of life every single day. But that one question planted doubt. Not medical doubt, but personal doubt. It made her feel like she was too old to deserve comfort or movement or relief. You see, these kinds of comments often come from doctors who have quietly decided your best years are behind you. They've made an internal calculation, not based on your health, but on a number. To them, 70 means slowing down. 75 means don't bother. 80 means what's the point? But you and I both know those numbers don't define your willpower, your dreams, or your capacity for healing. So if a doctor asks you this question, stop them right there. Tell them, yes, I do want to go through all that because I want to live well, not just exist. You are not a burden. You are not a lost cause. And you deserve a doctor who believes in your future just as much as you do. 3. Have you considered just letting nature take its course? This one gets under my skin. It's the question that's often delivered with a peaceful tone, a sigh of wisdom, and an air of gentle finality, like the doctor is offering a spiritual epiphany instead of a medical opinion. But don't be fooled. This question can be incredibly dangerous. Now, in some circumstances, yes, truly palliative ones, it can be a reasonable discussion. But more often than not, I've seen this question used as a cop-out. It's what a doctor says when they don't want to explain all your treatment options. It's what they say when they've already decided for you that fighting back isn't worth it. And most disturbingly, it's often said to older women more than any other group. Let me share a real case I'll never forget. An 82-year-old woman came into the hospital with early-stage breast cancer. She was otherwise quite healthy. She still volunteered at a local library, played bridge twice a week, and lived independently. Her doctor said, "At your age, maybe it's time to let nature take its course." She hadn't even been told about the option for a lumpectomy with minimal recovery. She hadn't even seen an oncologist yet. This recommendation wasn't based on her wishes or her prognosis. It was based on the doctor's own assumption that she was too old to matter. I sat with her, explained all the options, and she chose surgery. Guess what? She's still alive and well 5 years later. She beat it. And all because she didn't buy into the lie that old age means giving up. You are allowed to say no to treatment. That is your right. But it must be an informed no, not one that's guilted or whispered into you with a sugar-coated smile. So the next time a doctor suggests letting nature take its course, don't just nod. Ask, are you saying there are no options left? What would you suggest if I were 50? Is this recommendation based on evidence or your opinion of my age? You might be shocked by how quickly they backpedal, and you'll be proud of how powerfully you defended your right to choose. 4. Who's making your medical decisions for you? Now, at face value, this may sound like a routine question, especially if a patient comes in with a spouse, child, or caregiver. But I need to tell you something that most patients never realize. This question can be a subtle test, and the way it's asked can reveal far more about the doctor's mindset than yours. When a physician says, Who's making your medical decisions for you? They might be doing one of two things. They're assessing your mental sharpness without being honest about it, or they're looking for someone else to defer to because they don't fully respect you as the authority in the room. And both of those scenarios are terrifying. Let me tell you a story I'll never forget. A 76-year-old patient of mine, let's call her Eleanor, walked into a clinic for a checkup. Her daughter drove her just because the weather was bad. Eleanor was still managing her own medications, balancing her own checkbook, and cooking her own meals. But because she paused slightly when asked a medication dosage, the doctor turned to the daughter and said, "So, do you usually help her make medical decisions?" In that moment, Eleanor disappeared. The rest of the appointment was directed at the daughter. Eleanor's concerns dismissed, her words interrupted, her dignity slowly stripped away. And here's the part most people don't know. Once a doctor gets it in their head that you're not all there, even based on the flimsiest of clues, it changes how they document your chart. They may start adding notes about cognitive concern, impaired judgment, or the need for family input without ever formally testing or explaining anything to you. And that paper trail, it sticks. It can affect future care, insurance, hospital decisions, even legal matters. Now, of course, if a patient truly needs help due to dementia or decline, there's a place for that conversation. But it must be honest, transparent, and respectful, not whispered in code, and not triggered by a single pause or gray hair. So, what should you do if a doctor asks this? You calmly say, "I make my own decisions, but I value input from my family." Is there a reason you're asking? Make it clear that you are still in the driver's seat. And if they continue to talk around you instead of to you, you don't need a medical degree to know what's really going on. 5. Are you still driving? Now, this one might seem innocent. After all, driving is a basic activity. Doctors do need to assess it sometimes, especially when safety is a concern. But here's the problem. How and when this question is asked can reveal something much more unsettling. If you come in for a blood pressure check or arthritis or a skin rash and your doctor suddenly asks, "Are you still driving?" Pause. Because what they're doing might not be about driving at all. This question is often used as a covert screening for cognitive decline, a way to judge your independence, decision-making, and memory without telling you that's what they're doing. It's like they're testing you behind your back. And when you answer yes, they might note in your file, "Patient still driving may not be aware of own limitations." If you answer no, they might note loss of independence